Welcome to Health IQ. I'm Dr. Alan Siegel, your host. Today we have a special guest, Catherine Isaac. She's a board-certified internal medicine physician, and she specializes in mind-body medicine. Welcome, Dr. Isaac.
Thank you very much.
So I think most of our audience probably knows a little bit about what an internist does on a day-to-day basis, but that's not your typical practice at the moment. Tell us a little bit about what is mind-body medicine and what kind of got you into practicing this type of medicine.
Sure. So mind-body medicine is incorporating the idea that the mind can impact how you experience physical symptoms in your body. So a person who has something like high blood pressure can exacerbate that. Someone who has migraine headaches can be exacerbated by stress. And with the approach of mind-body medicine, we want to incorporate kind of all of the things that are happening within a patient, what their experiences are, what their symptoms are, any chronic illness, what's happening in their life, their lifestyle, and focus on reducing stress to improve their quality of life.
So stress, do you feel, is like the number one denominator for a lot of these conditions, or these conditions can be severely affected by stress? And that's,
absolutely.
Yeah.
It works both ways. Either stress is triggering something for the person, or they're diagnosed with a chronic disease, and then that's bringing about stress in their life.
All right. Now, as you're going through medical school and you're learning to become a physician, everyone hears about the standard of care and what is the standard of care for patients that become hypertensive or become diabetic, or maybe obesity is an issue, or they develop a cancer of some sort. And then there's a standard of care for that patient, and physicians are typically guided in that standard of care. Mm-hmm. How did you kind of realize that sometimes the standard of care, is appropriate, sometimes it's not appropriate, or do you just feel like you're a supplement to that standard of care?
I definitely see myself as being a supplement to the standard of care. People will frequently come to me because they're doing everything they can, and yet they're not necessarily feeling as well as they hope to be or that they can be. So what I really want to do is augment what they're already doing. The way that I kind of got interested in mind-body medicine, or at least part of it, is many of the tools that a person can use are simple, easy, and they don't come with a lot of side effects. So if it's something that you can incorporate in your life without having to go out and buy something or be somewhere special, to me that's an excellent modality to use for health.
And I think people have to understand that they have control, or more control, over either fixing their own health problems or preventing their own health problems. And I think as a mind-body medicine physician, I think discussing, really how the patient maybe got to where they are and how they can kind of get back to, their normal, optimal state of health, I think it is probably an important part of what you may discuss with your patients. I believe you probably believe that a lot of things that patients do go through are possibly preventable, right?
Absolutely. Absolutely. And the other interesting thing about it is that when a person is stressed, they have a harder time doing those preventative things to maintain their health, whether it's eating right or exercising or getting good quality sleep. Many of those things deteriorate as we get stressed, and those are the things that keep us healthy. They keep us feeling well.
Right, and stress, physiologically, what happens to our body? Like, what is going on in our bodies?
Sure.
I mean, people, they hear, I'm stressed,
right,
but they don't
right.
know exactly what are they feeling. Is it a sense of pressure? Is it a sense of just sleeplessness? Or is it a combination of all that? Or is there like hormonal changes? Like, what happens to our bodies typically under stress?
Absolutely. So the first thing is that you have to perceive that something perceive in a stressful event, and that stressful event doesn't have to be something which we classically think of as threatening. It could be, there's traffic on the way to work, or I'm not sure how that meeting is going to go. And that triggers or activates the fight or flight response in our body. And with the fight or flight response, just to keep it simple, you have the activation of the autonomic nervous system, specifically the sympathetic nervous system. And you're going to release norepinephrine, epinephrine, which we think of as adrenaline.
Adrenaline, okay.
And cortisol, which is a stress hormone. Now, the interesting thing about what happens in the body is very intelligent and it's well designed. So that adrenaline surge and the cortisol release is going to activate certain systems in the body, and then it's going to downplay certain systems in the body. So it's going to activate your cardiovascular system, because in the setting of what is considered to be a threat, fight or flight, we either need to fight out of the situation or run and escape the situation. So from a cardiovascular perspective, you're going to increase your heart rate, you're going to increase your blood pressure. You also have changes into the way that you think. So you're going to be more hypervigilant, trying to look for, be more reactive, more emotional. If there's a fire in the building, you're not going to try to sort out the 6 different exits and pick which one is closer to your car because it's raining. You're going to look for red and say, that must be exit, and head in that direction.
So there are true physiological effects that
Absolutely.
are actually, so when people feel like they're stressed, they actually can feel it. They can feel it in their body.
They're feeling the adrenaline surge in their body.
And then,
definitely.
not to get too technical, like you said, but long, sustained, stressful periods, where people, like, you may have a stressful day and then goes away. You may have a stressful event, not too bad, goes away. But then you have longer, sustained periods of stress. Does that put a lot of stress on your adrenal glands and your cortisol levels, where you hear sometimes like adrenal insufficiency, cortisol insufficiency, things of that nature? Is that like the long-term effects potentially of too much stress, and then you have the opposite effect of not having enough cortisol when you need it?
Sure. Yeah, I think, you can distinguish between adrenal insufficiency and then what some providers refer to as adrenal fatigue. I would say that adrenal insufficiency is more of a clear, lack of
clinical thing, right?
A clear clinical diagnosis.
Tested.
Right. Whereas adrenal fatigue would be one way of describing persistent excessive levels of negative stress.
Right.
And what we found is when a person has persistent elevated levels of negative stress, that often correlates with developing symptoms of some sort. And actually the clearest case is with cardiovascular disease in terms of the research out there. So there is a clear correlation with elevated stress levels and increased likelihood of developing heart disease, having a heart attack, or having worse survival after you've had a heart attack.
So some kind of inflammatory response even in the body. So is it inflammation, or is it actually built to like plaque and sclerosis and that level of cardiovascular disease, or a combination of?
It's a combination of both at this time, as far as we can understand it. Right. It's definitely a pro-inflammatory pathway, and it's definitely related to atherosclerosis. We don't understand all the specifics sort of in between. At this point, we just know that
clinically they can be tested. Sometimes they'll have a elevated CRP, or they'll have positive findings on other types of testing, echo stress tests, or thallium stress tests that they may go for if they're having symptomatic.
Yeah, if they're symptom for heart disease, if they're having symptoms for heart disease, absolutely.
So as a mind-body provider, what are some of the techniques that you use? What are some of the things that people may have heard of, like meditation, possibly biofeedback, image guidance?
I like to, personally, my area of expertise is meditation.
Okay.
So that's what I will instruct patients on in the office. It's great because people can come in to see me without a referral, and it's a medical visit, so it's covered by insurance, which is excellent. So during the visit, I kind of listen to the whole story and try to understand exactly where the stress is coming from, walk them through that with any modifiable things we could do via lifestyle, and then we work on meditation and mindfulness.
Now, meditation, people may think they know what it is. They've probably heard the term. What is it? What exactly is the patient doing? What are they trying to accomplish? Are there different levels of meditation? How do you learn to meditate properly? I mean, these are things that probably people think they know and they probably don't.
Right, and I'm so glad that you brought that up, because I do think a lot of us have preconceived ideas about what meditation is, and we kind of come up with this idea that it's difficult, or definitely something that we probably wouldn't want to do, and because maybe it sounds boring. But what you're doing as you're meditating is you're focusing your attention on something, whether it's your breath, or whether it's a repetition of a word, which is called a mantra, or whether it's sensations in your body. And as you're focusing your attention on that, you're trying to keep an attitude of sort of non-judgmental awareness. So just really allowing yourself to experience fully the practice, as opposed to sort of trying to critique everything as you go along. And the purpose of that, if just to go back to our discussion of what's happening with stress physiology, as you're focusing your attention in that way, it's really hard for you to be spending too much of your mental energy on thinking about, sort of negative thoughts or stressful thoughts. So part of your mind may still be going there, but you're not going to have your full attention focused on that. So you're switching your body's physiology from the fight or flight response to the relaxation response, which is the opposite autonomic effect. It's like turning on the brakes in the body.
Right. This must be a learned thing, I would think. Some people must have trouble doing this, I would think, at the beginning, right?
Yes, and what I actually like to tell everybody when they come in the office and are interested in meditation is that you knew how to do this at some point in your life. We're
Right.
all born with this skill. It's just a matter of using that muscle or not. Muscle. And so, if you can have the confidence to know that you knew how to do that at some point, and it's just a matter of remembering, then you can rebuild the skill again. The other thing I like to tell people is not to believe that you're going to practice meditation and not have any thoughts. People think that they're going to sit down, their mind is going to be totally blank, and they're going to feel complete bliss. And, to have an expectation like that is completely unreasonable, I think, of pretty much 99.5% of people who are going to try to approach
Just
meditation.
Blank out,
Yeah, exactly.
Sort of when I try that at night when I can't sleep, I think of a black hole and I just stare at it.
Right.
It doesn't always work. So.
Right. Yeah, and so I really like to have a fluid definition of meditation. Meditation, it could be focusing your attention, as I said, on your breath. It could be focusing your attention on a pleasant memory or a pleasant experience. That would be like a visualization. There's a type of meditation called metta meditation, which I like to incorporate in my classes, which is cultivating compassion and joyful feelings. That's where you imagine sending good thoughts to people you care about. It puts your whole sort of physiology in a place of feeling good, feeling joy.
And it takes your mind off of maybe some of those stresses. I mentioned sleep, so let's just talk about sleep. How disruptive is stress and physiological illness to the sleep patterns, and then how bad is that for our bodies, and how do we help correct those issues? Is it something that you hear about all these different sleep aids, Ambiens, yes, and all these different types of medications to help sleep, even sometimes melatonin.
Yes.
Both my kids take it. I'm not trying. What are they getting?
Right.
Sometimes supplementing melatonin can help with sleep. Where do you see the sleep being like a problem, and how can it be corrected with some of these mind-body techniques?
So I see sleep as being like the little engine light that comes on in your car to alert you that there's something going on. So it's not necessarily that sleep itself is a problem, but most of the time, not every time, but most of the time, it's because the person is stressed. And I also like to tell people not to worry about, the fact that you're struggling and not sleeping. Because if you start thinking about, this is going to have negative health effects because I'm not getting a good night's sleep tonight, that's just going to impact your ability to fall back to sleep.
It can compound it.
Exactly. And that I hear that a lot. So, I do see a lot of people in the office coming in with difficulty with sleep. And what I like to say is, let's focus on helping you manage stress first. And what usually happens is sleep just naturally improves as the person's learning skills like meditation or breathing techniques or yoga, Tai Chi. The stress level decrease, the sleep just naturally improves.
Now, as a board-certified internal medicine doctor, and you work in a medical group practice with various types of specialists, how do you coordinate your care with those specialists, and how do they, probably 10, 15, 20 years ago, they may not have, been interested in what you're doing, but now maybe some of them are very interested in what you do, and they see the actual results. So
the results are what matters the most. People feeling better.
Pudding, right?
Exactly. People feeling better, and people come back because of that. So
And then trying to get, as you're doing your intakes, you probably see that they're maybe on a host of certain medications based on their condition, and whether it's hypertension or high cholesterol or some kind of anti-inflammatory medication or whatever their particular issues are. Do you find once they're working with you that over time that they're actually to come off certain medications because their physiological state is improving?
Yeah. So
I think that's kind of important for the patients.
So I was really grateful that Scarsdale Medical Group invited me to be a part of their practice because, as you said, especially coming down to Westchester, I trained in Boston, where there's the Institute for Mind-Body Medicine. Has a long history there, so people, recognize the word mind-body medicine, they understand it, and they accept it, which also took some time to come into play. But so now at Scarsdale Medical Group, it's great. We have a multi-specialty practice, and a lot of the providers understand that their patients are feeling stressed. And, we can only do so much individually as providers, so it's great working together as a team because they can say, all right, we're working on your migraines, we're working on your medications, we're working on, we're going to add some magnesium. We also want you to see Dr. Isaac because you're telling me you have elevated stress levels, and we know that plays a role. Or, with the cardiology group, they have people who, had a recent heart attack, and, they're having elevated stress after the event. That's a perfect time to come in and be seen by me. And actually, when I was in Boston, I used to be a part of the cardiac rehabilitation team. We had designed a whole program that incorporated stress reduction as a pathway to restoring health after an event like a heart attack.
Right, so the more open the providers are in working together, really the better for the patient. So
yeah, absolutely.
And I think if more people would even look into mind-body medicine, preventive medicine, work with nutritionists if they're struggling with certain things, if working with acupuncturists, physical therapists for different physical ailments, kind of like always involved in their health care. I think patients don't realize how much they have control over their health. Just proper diet, proper nutrition, proper exercise, proper sleep. We can't avoid everything, and we can't avoid chemical stresses, environmental stresses, physical stresses. These things are always going to be coming at us. It's how does our body process and deal with these things?
Right, exactly.
And that's the key to it. Now, you mentioned magnesium. How much, do you believe in supplementation, nutritional supplementation? Obviously we try and eat well. We tell people to try and eat well, but truth be told is most people probably don't eat well enough, and they really don't eat the recommended amount of kale and spinach and all the high antioxidant foods. And
my perspective is I like to sort of provide guidance and anything that is evidence-based. And so really when a patient's coming in, if they're on a collection of supplements, I want to go through the list with them, make sure that there's no drug-herb interaction, no drug-supplement interaction. That's important. People oftentimes forget because they think they're taking like something like magnesium or potassium, which can be found in food, that it could potentially interact with a medication that were either started on by their doctor or we're talking about starting.
Right.
So I'd like to provide guidance, and my personal philosophy is really just simplicity. I think that if a person is prescribed 15 meds, the likelihood that they're going to be able to adhere to that, is lower than if they're on a simplified regimen. And the same thing with supplements. If, I've seen people who are coming in and, okay, I'm going to take these 10, pills, capsules in the morning, and then I take this at lunch, and then I take that at bedtime. It's very complicated. And I think it also can reinforce the idea of a sick sort of identity as opposed to a wellness identity.
Right.
So what I really want to do is just provide guidance, safety, and keep it simple.
Keep it simple, right?
Yeah.
All right. Now, you did mention something I found sort of interesting, evidence-based, and we hear this a lot as providers, and we hear this a lot in the community as what is, and that goes back to what's the standard of care and what, what's been researched and what's been proven to be true. I think as a mind-body practitioner, I would think that you have to be open-minded and willing to understand that we don't know everything, and
Absolutely.
we barely know anything really, if you
Right.
think about it. So to only go by evidence-based things without going too far with the fringe, I think sometimes you have to always, do no harm, and those, if you
Right.
follow those guidelines with your patients and do what you think is in the best interest of your patient, you'll always be doing the
Yeah.
best medicine or the best health care you can provide. So
I think it's a risk-benefit
Yeah.
analysis.
Right.
So I do recommend some alternative modalities, which at this point there may not necessarily be evidence on it yet. Things like craniosacral therapy, I find it really helpful for people who are experiencing chronic pain. I definitely like to recommend chiropractic, although there's a lot more evidence to support the use of chiropractic manipulation. And my goal is, well, what is the risk associated compared to what is the potential benefit? And for something like meditation, no risk
Right.
associated.
Minimal risk, yes.
Craniosacral therapy, it's very light touch, so it's very good for people who are experiencing severe pain. The likelihood of any adverse outcome really low. So I always kind of try to keep those things in mind and definitely keep an open mind. And if the patient's suffering and we've tried a lot of different things, then we have to think outside the box.
Yeah, absolutely, and I think that's important to kind of have a good mix, like more tools in the tool chest, so to speak, and what can our patients benefit from. So, so what conditions, overall? I know we spoke a little bit about some cardiovascular, hypertension.
Yeah.
You mentioned some headaches, chronic pain patients. Any other things that people would be thinking about for
gastrointestinal disorders like irritable bowel syndrome, or people who have Crohn's or ulcerative colitis. Other types of autoimmune disorders like rheumatoid arthritis or lupus, skin conditions, allergy. I mean, I've kind of seen anything and everything.
Yeah.
Seizure.
And some of the techniques you feel are able to help them control some of the symptoms.
Absolutely.
Abate some of the symptoms in some cases, and do some of those things. Yeah.
Yeah, and what I always
Which is interesting, because like when you some of those autoimmune problems that you spoke about, also with colitis, they end up on heavy duty medications, prednisone therapy,
Right.
steroid therapy, which are more detrimental.
that carry their own set of side effects.
Yeah,
Absolutely.
so trying to help, and then really understand the cause of those diseases. There's evidence based to what might put the fire out temporarily, but no one even knows what's causing the problem. So
right.
It's
What
an
I like
interesting balance.
What I like to tell people when they come in the office is, let's make the focus of your treatment to feel well, and do what we need to do in order to get you feeling well. And then at that point, we can talk about coming off medication. Because many people that come in to see me, they would say, I would love to get off my blood pressure medication, or I'd love to get off my diabetic medication. And as long as your numbers are good, I'm all for it.
Right.
I think that's great.
Sure.
But my goal, underlying it all, is to want to feel well and to be healthy and to live a good quality life. So make that your central point of focus. And then once you've achieved that, if the other things improve because now you've started exercising and you feel really good moving, and you're meditating and you've really cut out a lot of salt and you're eating your fruits and vegetables, and that gets you off your diuretic or whatever it may be, great. But if people, sometimes you can kind of have a conflicting goal. I want to get off my medication, but I also want my blood pressure to be under control. So it doesn't always happen that you're able to do that.
Right, at least not right away, without going through like a course of care. I think, look, we're in a now society. Everybody wants now. It's like, I want it done now. So,
which is really interesting when you're trying to teach and practice meditation, because that is we want to be in the now and be okay with now exactly how it is.
Right.
Without trying to force anything.
We've pushed over decades and decades of take a pill for this, take a pill for that, and people have said, okay, well, I could just take this medication, I take that medication.
Right.
And
it's certainly easier.
It's definitely easier.
Seems easier.
It seems easier, but they also understand they're putting stress on their liver, they're putting stress on their kidneys, they're doing other things physiologically to the body that they're not thinking about as well. So.
And oftentimes it can be a Band-Aid.
Yes.
And you see that sometimes, and this isn't true for everybody, but sometimes for people who are coming in with some certain degree of anxiety or depression, they're not necessarily taking account of kind of where their thoughts are at, what's happening in their life, and they're kind of like, all right, well, I'm going to take this medicine and that'll help me feel better.
Now, people, I'm glad you brought that up too. So, so from a psychological perspective, we're trying to help them and we're trying to work with them, but some people may need further care. Maybe they're coming in, and they, whether it's psychiatric or psychological issues that are really deeper than and working with other types of professionals,
trauma or something like that.
They may come in needing certain types of medications.
Yeah, definitely. And I certainly prescribe antidepressants if it's called for, or I refer out. And I say this really. What's going on is consistent with a significant moderate to severe depression, and we've got to treat that. We've got to take care of that. And when you do that, it'll probably be easier for you to lose weight and get your diabetes under control, et cetera, et cetera. So absolutely, whenever I need to refer to psychiatry or a talk therapist or counselor, grief counselor, whatever it might be, I try to bring them into the fold so that the person has varying levels of support.
As part of the whole team approach and everything. And diabetes and obesity in particular, those are, I don't want to use the word self-inflicted because that wouldn't be fair to the population, but there's definitely a preventable approach for many of those patients, and even to some degree reversible. So trying to work on diet and exercise as part of a whole mind-body approach. I don't know, the meditation alone is going to help those.
Right.
We have to come up with a sort of a comprehensive plan.
And it's actually good that you say that, because I never suggest to anybody that meditation alone is going to be the perfect remedy. To me, that doesn't make sense. What I say is, let's do everything we can to get you feeling well. And part of that is going to include
the power of touch, massage therapy, the power of craniosacral work, things that not for necessarily the diabetic and obese population, but for people that are needing that level of care. There's a lot of different approaches you can have for those patients. So, and we didn't really mention acupuncture, but that also having clinical accolades. Not always evidence-based, some of it yes, some of it no.
Yeah,
but
definitely, particularly for fertility.
Yes.
It's a good, something that I like to incorporate. And actually you see that a lot now for women who are interested in getting pregnant.
Right. If their stress levels are too high, that's not good.
And it's a big piece.
It's a big part of it, And then until they correct that and the hormone levels.
Right, and actually that was something I wanted to mention earlier when you were asking me about what happens in the body. So yes, you're going to activate your cardiovascular system, but what makes sense in terms of why people develop a lot of symptoms when they're stressed is that your body is actually going to suppress the activity of the systems it doesn't need, like your reproductive system, like your gastrointestinal system. You're not going to sit down and have a big meal in the middle of a serious, threatening event. So, if you're chronically stressed, a lot of people can then develop irritable bowel. They have constipation, they have bloating, they feel, a sense of poor digestion. It just makes sense.
So in terms of, besides meditation, are there any other techniques that you like to incorporate, just real quick to talk about some other things?
Sure. Not that I personally do, but I definitely incorporate.
Biofeedback considered mind, body?
Yeah, definitely. Biofeedback,
okay.
Absolutely. I actually love biofeedback for people who are having pelvic floor dysfunction, people who are having, pain or difficulty with urination, chronic pelvic pain, people who are having chronic constipation. The pelvic floor biofeedback really can, in conjunction with pelvic floor PT, can really do a lot.
What is, just describe biofeedback really quick, because I don't even know if people know exactly what it is or what's actually done.
Sure. You basically have a little monitor that you wear, and it's connected to a machine that's going to provide information about what's happening physiologically in your body. So it's biofeedback. It's giving you feedback as to how active a signal is. So you can literally watch that and then determine if you're activating the signal or if you're, suppressing the signal. So in terms of, muscle tension, you can see is the muscle tense, is the muscle relaxed. And so you're training yourself to help to relax any areas of tension.
And so whatever technique you're doing, whether not necessarily meditation at the time, but if you did, you'd be able to see that, hey, this is actually working.
Right.
So it's actually an instrument to give you the feedback that you're able to relax a little bit. So that's interesting. So
yeah.
All right. Well, look, I think we touched on a couple of nice topics. Mind-body medicine, I think, will definitely be part of the future of medicine, and I think that Scarsdale Medical Group has made a very good choice in bringing you on as part of their team, and I think the patients there will benefit from having you there. So I think as a chiropractor and being involved in sort of integrative and progressive medicine, I think it's a great thing for the patients. So
thank you. Appreciate being here.
All right. So thank you for being here. Thank you for watching Health IQ. I'm Dr. Alan Siegel. I hope you enjoyed the show. We'll see you next time. Bye bye.